Thanks to advancements in vision correction technology, it's now possible to treat a lifetime of nearsightedness, farsightedness, and astigmatism in a matter of seconds. It's called laser vision correction. By combining the accuracy of the excimer laser with the precision of advanced computer technology, hundreds of thousands of men and women every year are discovering LASIK, the most advanced form of laser vision correction and the world beyond glasses and contact lenses.
I actually noticed the next morning when I woke up, when I looked at the alarm clock, and I could see it just like I had my contact lenses in, only I didn't have my contact lenses in, and I didn't have to go through that dread of putting them in, and I didn't have to stumble and reach for my glasses and try and find them to see what time it was. That was the moment that I realized that, hey, this worked, and it's incredible.
LASIK is short for laser in situ keratomileusis, which simply means to shape the cornea within using a laser. In order for the eye to focus light clearly on the retina, the outer window of the eye, or cornea, must be of the proper curvature. Light then passes through the pupil and travels through the lens of the eye and is then focused on the specialized nerve cells of the retina. These cells convert the light to electrical signals and send them to the brain, which interprets these signals as vision. Nearsightedness can occur when the cornea has too steep a curve, or the eye is too long in relation to its corneal curvature. This causes images to focus in front of the retina instead of on it. Nearsighted people can see things up close, but their distance vision is blurry. If the cornea is shaped like a football, more curved along one meridian than the other, that's known as regular astigmatism. Astigmatism causes images to bend in such a way as to create no single point of focus, resulting in blurry and often distorted vision. Farsightedness can occur if the cornea is too flat or if the eye is too short. This causes images to focus at a hypothetical point beyond the retina. People who are farsighted can have difficulty seeing objects both at a distance and close up without corrective lenses. In order to correct the way light is focused, LASIK reshapes the cornea using the cool light of the excimer laser. First, a thin protective flap of corneal tissue is gently folded back using an instrument known as a microkeratome. If treating nearsightedness, the laser removes tissue from the center of the cornea, making it flatter and reducing its focusing power. This moves the point of focus from in front of the retina to on the retina. If treating farsightedness, the cornea is made steeper as the laser removes tissue from the outer margins of the cornea. This helps the cornea bend light more, moving the point of focus from somewhere behind the retina to on the retina. If treating regular astigmatism, the laser removes tissue from the steeper meridian, thereby making the cornea more spherical. This allows light images to come to one point of focus on the retina. The protective flap is then folded back in place, where it bonds without the need for stitches. On the day of the procedure, you'll arrive 30 minutes to an hour before surgery. You may be given a mild sedative to help you relax, and eye drops will be placed in your eyes. Because the eye is easily numbed with drops, there is no need for injections. The procedure itself takes only minutes and is virtually painless.
Beforehand, of course, I was nervous. I didn't know what to expect, and the whole idea of someone coming in and manipulating your eyeball and utilizing a laser to correct your vision is somewhat scary, but the actual procedure isn't scary at all once you have it done. You're really sitting in almost like a dentist's chair, and the procedure itself takes maybe 5 to 7 minutes from start to finish, and it's painless. I didn't really experience any pain whatsoever.
The goal of LASIK is to reduce or eliminate your dependence on glasses or contact lenses. LASIK does not always create perfect vision, and we cannot guarantee your results. However, the vast majority of patients see 20/40 or better without glasses or contacts, which is legal driving vision. LASIK does not treat a condition that affects us all, called presbyopia. As we age, usually around age 40, the lens inside our eye begins to lose its ability to change shape, which gives us the ability to shift our focus from a distant object to something up close. If you're having your vision corrected for nearsightedness, you may still need some correction for close work when you become presbyopic. If you are presbyopic or soon to become presbyopic, you might want to consider having one eye corrected for distance and the other left slightly nearsighted to lessen your need for reading correction. LASIK, like any other medical procedure, carries some risks. You should be fully aware of the risks associated with these procedures before you proceed. We'll be happy to answer any questions you may have. LASIK is an elective procedure. Therefore, most insurance companies will not cover its cost. We may, however, be able to provide financing options with monthly payments to fit your budget. Finding out about the health of your eyes and the degree of your nearsightedness, farsightedness, or astigmatism is your first step toward visual independence. Therefore, a complete eye exam will be necessary to determine if you're a candidate for LASIK. If you feel glasses or contacts are keeping you from enjoying life to the fullest, let us help you determine if LASIK could help you discover the world beyond glasses and contact lenses.